Hello everyone, I'm Aditya Gangal from THIP Media. Today we will talk about myositis, a health condition that affects muscles. For today's discussion, we have Dr. Kashyap Dakshini with us. He's a general physician practicing in Mumbai and has 26 years experience of working with different hospitals and corporates.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello, Dr. Kashyap. Thank you for showing up for today's quick session. Our topic of discussion is myositis. These days, myositis is all over the news. Uh, Recently, a South Indian actor, Samantha Ruth Prabhu, I'm sure you must have heard about her.
Yes.
She shared a social media post on how she's recovering from this health condition. So, like, I'm sure most of the people doesn't have complete knowledge of what myositis is. The available information tells that myositis is a group of rare health conditions that have main symptoms of weak, aching, and painful muscles. So, I would like to know what exactly causes myositis, and exactly like really is it a serious health condition?
Yeah, sure. So, myositis is basically the inflammation of the muscles. This causes weakness, that is muscle weakness, and it also causes difficulty in movement or using those muscles. So, myositis is essentially of two major types, if I may say. One is the primary myositis, which commonly refers to as primary autoimmune diseases like dermatomyositis or myopathy. Dermatomyositis being the inflammation of the skin as well as the muscles. And if autoimmune, then the immune system will start attacking the body and will also affect the muscles of the body. So our own immune system will attack our own muscles of the body. Now that's as far as primary myositis is concerned. Secondary myositis, so there can be various other causes of myositis, for example infections or drugs or rheumatological diseases or malignancies. So various infections which may be either bacterial or viral or fungal or parasitic infections can cause myositis. Certain drugs may also cause myositis. So drugs which are
Okay.
used for cancer treatment or penicillamine or even interferon beta or at times even chloroquine or hydroxychloroquine. Then certain rheumatological conditions can also cause myositis, like lupus. If I'm sure most people have heard of lupus, or SLE, it's called, or connective tissue disorders can cause myositis, and at times it can also be because of some kind of a malignancy. So cancer can coexist along with myositis or can cause myositis. Now, the main symptoms of myositis being proximal muscle weakness. So it's weakness of the muscles which are more towards the main axis of the body. For example, shoulders or thighs. And at times it can also affect the food pipe muscles or the muscles which are involved in breathing. For example, the diaphragm. So that's what a myositis is essentially all about in a nutshell. And definitely, yes, it's a very serious disease, and at the same time it's very rare to diagnose. And
Okay.
so because it is so rare, clinicians don't commonly think of myositis as a straightforward diagnosis, except if one is seeing a rheumatologist. Then a rheumatologist will definitely be able to diagnose, because that's his specialty. But if you commonly meet doctors across, then this does not form a part of the first list of differential diagnoses.
Okay.
So hence it remains undiagnosed very commonly. And but about 95% of the patients suffering from myositis will survive beyond 5 years.
Okay. Okay. How myositis is generally diagnosed? Also, can a simple blood test suspect a person of myositis?
Sure. So myositis, because it, as the definition itself is, it's the inflammation of the muscles. So all these symptoms which we spoke about, difficulty in getting up, in standing up from sitting position or standing up from a chair, or getting up from the floor, difficulty in, symptoms like these, then difficulty in swallowing at times depression can, if all these symptoms coexist, then that can give a suspicion for myositis. And in case of dermatomyositis, there is a rash, on the sometimes in the face, chest, knees, etc. So these are clinical symptoms. If grouped together, then that can lead to suspicion of myositis. But then, as you rightly said, certain tests would need to be done to
Yeah.
diagnose it. So along with the clinical features, tests like creatinine kinase, which is commonly a blood test done, so that can help in the diagnosis of myositis. And along with that, tests like electromyography, that's called EMG in short, and then to be very certain whether it's myositis or not, a muscle biopsy is a kind of conclusive test, to diagnose myositis, and then an MRI as well. you know so tests like these would help in the diagnosis of myositis.
How common myositis is in India? And can we say it is gender specific?
Yeah. So yes, myositis is not so very common. It's very rare, and frankly, the exact epidemiology of myositis has not been studied in India, and even worldwide, there's very limited information.
Okay.
But one such study using the administrative claims data in Canada, where there were about 7.5 million beneficiaries, there is an estimated prevalence of approximately 21 to 22 cases per 100,000 population
Okay.
for dermatomyositis and polymyositis. And the overall prevalence of all types of myositis, whether primary or secondary due to any cause, as per this administrative claims database of Canada, is approximately 14 to 22 per 100,000 population.
Okay.
That's the, yeah.
So also, so can we say myositis is gender specific?
Yeah, I mean, males and females almost, more or less a similar kind of prevalence,
How, once diagnosed, how myositis is treated, and specifically in Indian context. Also,
True.
does diet have a role to play in recovery from myositis?
Okay. So,
Yeah.
treatment of myositis, essentially one has to identify whether it is primary or it is secondary. So if it is primary, then of course physical exercise, physiotherapy, strengthening muscles, and if it's affecting the muscles of speech, then speech therapy, and then commonly very strong drugs like steroids or azathioprine or methotrexate or intravenous immunoglobulins are used, or even these days immunomodulators like rituximab are used, and even plasmapheresis has been used in the treatment of myositis. But that's as far as a primary cause of myositis is concerned, if it is more of an autoimmune reason. If it is secondary myositis, which is if it is secondary to any infection, then treatment of that infection. If it is secondary to a particular drug, then withdrawal of that offending drug will lead to resolution of symptoms of myositis. And then if it is, of course, as a result of any rheumatological disease like lupus, for example, then treatment of lupus. Or if it is as a result of a malignancy or kind of cancer, then treatment towards that malignancy or cancer would lead to resolution of symptoms of myositis. And any kind of diet. So typically, diet is not the mainstay of treatment in of myositis. But yes, a diet which is richer in protein will help in some kind of muscle generation. So a high protein diet would definitely help to some extent, but is not the mainstay treatment of myositis. Have a diet which is rich in protein. These factors would help in supporting the treatment of myositis.
Thank you once again for showing up, taking your time out, and help us with creating awareness on health.
Bye.